Hi, I'm Porscha Johnson Williams, Executive Owner and Principal Consultant of PJW Clinical Pharmacy Consulting. As a precision oncology consultant and clinical pharmacist, I specialize in biomarker-driven treatment strategy. Throughout this presentation, I'll walk through how a pharmacist-led precision oncology model integrates across the cancer care continuum, from biomarker testing through treatment selection, and more importantly, how this role helps close the gap between data generation and real-world patient impact. Precision medicine doesn't deliver value at the point of testing, it delivers value at the point of decision making. I'd like to walk through how a precision oncology consultant integrates into the biomarker to treatment workflow, and more importantly, why that role matters in translating complex genomic data into real-world patient impact. I lead an independent precision oncology consulting practice that supports oncology care teams across multiple institutions. My work focuses on helping providers translate biomarker data into clinically actionable treatment strategies, especially in settings where precision medicine infrastructure or dedicated resources may be limited. I function as an extension of the oncology care team, truly bridging the gap between molecular data and treatment decision-making. To ground this discussion, I'll start with a brief overview of the practice model, who we serve, how the model is structured, and why it was built. As pharmacists, we sit at a unique intersection of science and clinical decision-making. This model was established to solve a growing problem in oncology, the increasing complexity of biomarker-driven care. Many institutions either lacked access to molecular tumor boards or struggled to sustain them, particularly during COVID. As a result, I serve as both an expert second opinion reviewer and a consultant helping institutions build and optimize precision oncology workflows. Precision medicine only works if the data can be interpreted, applied, and operationalized, and that's where the pharmacist truly adds strategic value. Now that I've outlined the model, let's walk through how this comes to life at the patient level. In this model, I engage once biomarker testing has already been completed and a case is referred for consult. I review the patient's full clinical context, diagnosis, staging, prior therapies, and sequencing results, and then synthesize this into a concise recommendation report outlining treatment options, clinical trials, and even next steps. I define our highest value point as the moment where complex molecular data is translated into a clear, actionable treatment strategy. I turn that static biomarker report into a dynamic, patient-specific treatment roadmap. To understand where the pharmacist adds value, it's important to first look upstream at how biomarker testing is structured and initiated. The pharmacist's value extends beyond interpretation into execution. I help ensure therapies are not only biologically appropriate, but also safe, feasible, and individualized. This includes managing drug-drug interactions, optimizing dosing for targeted therapies, addressing formulation needs, and aligning treatment options with the patient's clinical and social context. Precision medicine isn't just about selecting the right drug, it's also about ensuring that that drug is deliverable, tolerable, and aligned with that patient. Once testing is completed, the next critical step is how those results are accessed, interpreted, and translated into action. While testing is typically completed before I engage, a key part of my role is identifying gaps, such as missing fusion detection or outdated sequencing, and recommending additional testing when necessary. Because data formats vary across institutions significantly, I often serve as a central point of interpretation, ensuring that those results are consistently translated into actionable insights. So the complexity of the data makes the pharmacist's role not optional, but truly essential. In order to reach optimal patient outcomes, these molecular insights need to be operationalized through structured decision-making and multidisciplinary collaboration. Precision medicine requires not just information, but infrastructure for decision-making. As precision oncology becomes more complex, decision-making cannot happen in isolation. Structured governance, whether through a molecular tumor board or a consultative model, is essential to ensure that biomarker data is consistently interpreted, vetted, and applied in a clinically meaningful way. In my model, governance is intentionally flexible. It can function as an independent consultative service or integrate into a formal molecular tumor board, depending on that particular institution's needs. Within these settings, I play a central role in therapy selection, evidence evaluation, and clinical trial identification, ensuring decisions are both scientifically sound and clinically actionable. At its core, it is decision-making that should be multidisciplinary, bringing together oncology, pharmacy, molecular pathology or variant scientists, genetics, nursing, and research team members. Each role contributes a distinct lens, but the pharmacist is uniquely positioned at the intersection of molecular interpretation and therapeutic application. The value of the model isn't just in who participates, it's in how insights are synthesized into action. These discussions focus on translating biomarker findings into real-world treatment strategies. So common topics include therapy selection based off of genetic drivers, managing drug-drug interactions and toxicity risk, navigating negative or non-informative profiles, identifying clinical trials, or even supporting off-label access and feasibility considerations. Within this framework, I take a leading role in therapy recommendations, evidence synthesis, clinical trial identification, and ensuring that the patient treatment plans are not only evidence-based, but implementable in the real-world setting. As the volume and complexity of genomic data continues to grow, governance is no longer optional, and the pharmacist is central to making these decisions actionable. The pharmacist serves as the bridge between molecular insight and therapeutic execution, ensuring that precision medicine decisions are not just innovative, but implementable. Finally, I'll touch on how providers engage with this model in real time and what makes this approach distinct from traditional oncology pharmacy. Providers can engage with me through email-based consults or live discussions. What differentiates this model is timing and scope. Rather than engaging after treatment is selected, I engage upstream at the point of biomarker interpretation and strategy development. Traditional oncology pharmacy is often reactive. This model that I practice in is proactive, strategic, and embedded earlier in the decision-making process. I'll close by bringing this all together. What this model ultimately means for patients, providers, and the broader oncology landscape. At its core, this model improves the quality and timeliness of precision oncology decisions. It expands access to expert interpretation, reduces delays in care, and helps ensure that every patient's molecular profile is fully leveraged. Ultimately, it positions the pharmacist as a critical driver of precision medicine, not just supporting care, but shaping it. As a precision oncology consultant, I translate complex genomic data into actionable patient-specific treatment strategies, bridging gaps in molecular tumor board access, improving decision quality, and enabling real-world implementation of precision medicine. The pharmacist is no longer adjacent to precision medicine. We are central to making it actionable.